Pregnancy is a life-changing event that can bring joy, excitement, and sometimes uncertainty. For many women, the question of whether or not they are pregnant can be a source of anxiety and anticipation. There are several ways to determine if you are pregnant, ranging from at-home pregnancy tests to more advanced medical procedures. One of the most common ways to determine if you are pregnant is by taking a home pregnancy test. These tests are widely available at drugstores and can be purchased without a prescription. Home pregnancy tests work by detecting the presence of a hormone called human chorionic gonadotropin, HCG, in your urine. This hormone is produced by the placenta shortly after a fertilized egg attaches to the uterine lining. To take a home pregnancy test, you simply need to collect a sample of your urine and follow the instructions provided with the test kit. Most tests require you to either dip a test strip into the urine sample or place a few drops of urine onto a test stick. After a few minutes, the test will display either a positive or negative result, indicating whether or not HCG is present in your urine. It is important to note that home pregnancy tests are not always 100% accurate. False negatives can occur if the test is taken too early in the pregnancy or if the test is not done correctly. False positives are less common, but can happen if the test is expired or if there is a medical condition causing elevated levels of HCG in your body. If you have taken a home pregnancy test and received a positive result, it is recommended that you follow up with a healthcare provider for confirmation. Your doctor can perform a blood test to measure the levels of HCG in your bloodstream, which can provide a more accurate indication of pregnancy. Another way to determine if you are pregnant is by monitoring your body for early signs and symptoms of pregnancy. Some common early signs of pregnancy include missed periods, nausea, breast tenderness, fatigue, and frequent urination. However, these symptoms can also be caused by other factors, such as stress, illness, or hormonal changes. If you are experiencing any of these symptoms and suspect that you may be pregnant, it is important to consult with a healthcare provider for further evaluation. Your doctor can perform a physical exam, review your medical history, and order additional tests to confirm or rule out pregnancy. In some cases, a healthcare provider may recommend more advanced diagnostic tests to determine if you are pregnant. One common test is an ultrasound, which uses high-frequency sound waves to create images of the inside of your uterus. An ultrasound can detect the presence of a developing embryo or fetus as early as 5 to 6 weeks after conception. Another diagnostic test that may be recommended is a pelvic exam, which allows your doctor to check for physical signs of pregnancy, such as an enlarged uterus or changes in the cervix. Your doctor may also order a blood test to measure levels of HCG in your bloodstream, which can provide a more accurate indication of pregnancy than a urine test. If you are unsure about whether or not you are pregnant, it is important to seek medical advice as soon as possible. Early detection of pregnancy is important for ensuring the health and well-being of both you and your baby. Your healthcare provider can provide guidance, support, and resources to help you navigate this exciting and sometimes overwhelming time in your life. In conclusion, there are several ways to determine if you are pregnant, ranging from at-home pregnancy tests to more advanced medical procedures. If you suspect that you may be pregnant, it is important to consult with a healthcare provider for confirmation and guidance. Remember, pregnancy is a natural and beautiful process, and there are many resources available to support you on this journey.